First of all, I want to say namaste.
Most adult day programs aren't designed to engage people with both developmental disabilities and dementia.
It's not the regular yoga, but I create some modifications especially for the members.
And the Opportunity Tree is trying to tackle that issue.
We do different things during the day, like we do some art, we bring some ideas to keep the members especially focused on the memory.
I like to use stencils with a cotton balls, with a clothespin.
The Opportunity Tree is a nonprofit with nearly 60 years of experience, providing services to individuals with intellectual and developmental disabilities. Services such as youth programs and employment programs.
So we started the Supported Aging program to target our members over 50, but we're especially focusing on the ones who may be experiencing signs or symptoms of dementia. Some of our population, they get dementia at higher rates and younger ages than the general population. There's really no programs like this out there.
The Supportive Aging program not only benefits from Layla's background in public health and community interventions, but also from the Opportunity Tree's partnership with Hospice of the Valley.
So Hospice of the Valley are experts in dementia care. We work very closely to develop the modules, the tracking, just the whole program design.
Dr. Bill.
We specifically chose members that we saw might be experiencing some symptoms of dementia. Not all of them have an official diagnosis, as it's really hard to diagnose people with disabilities. We try to provide meaningful activities for our members to stay engaged during the day and to keep their minds active.
Dr. Jill Hamilton is the medical director of Supportive Care for Dementia, which is a program sponsored by Hospice of the Valley that takes care of people with all levels of dementia.
We have a 3-year grant from the federal government to help, among other things, people with developmental disabilities who then develop Alzheimer's. And so we've looked and looked for an organization that would help us to help those people. And Opportunity Tree was willing, was innovative, was creative, and we are creating the first program nationally that works with people who have both developmental disabilities and Alzheimer's to find the right activities for both.
I like all the outings, bowling, golfing, movie theaters.
So far, I think the program has been really beneficial to our members. From when I first met them until now, with the 7 months of programming we've had, I've seen changes. I've seen them, be more responsive to trying new activities, be much more engaged in some of the activities that we do.
We make art. We painting, Muppets, music and dancing.